Good morning, everyone, and welcome to this special presentation on our 13 Now Digital First platform. I'm Tom Lewis, and we're excited that you're here with us today. We are joined once again for an encore show, if you will. We did this about a month or so ago with Bay District School Superintendent Bill Husfelt and Dr. Frank Merritt, a local physician, and we're talking about COVID again. Gentlemen, thanks very much for being with us today. We appreciate y'all.
Wait a minute, I thought
here.
we were talking about college football.
No, I wish. I wish.
Well, I just had one. I had one question. How many points against Miami, Doc?
You know, I'm going to be. All of us have been Nick Sabanized. We just want the win. We want to perform well and want to win. We don't care about the points.
Yeah, that's what FSU said when we played y'all about 5 or 6 years ago, too.
Yeah.
Well, listen, let's get down to it. We're talking about COVID, and it's been kind of an eventful week. We had, Bill, you called a news conference regarding some, I'd say, misinformation or some recommendations by people in the community to literally lie to school officials about whether their kids are having COVID shots or have had their vaccinations or whether they've been around anybody with symptoms. And I know that's got to be frustrating as you're trying to operate a system with about 30,000 people in it.
Yeah, it is, and we dealt with it, and we think it's over with. But the thing is, when people think, we're closed Friday, well, nothing stops. And my phone was blowing up, my text messages, my email, people kept sending me something that somebody was telling parents, and so they wanted me to do something about it. And so we got to worked on it and put something together, and I think it's over with now. We just need our parents and our students and our community to be able to trust us, but we need to be able to trust them too. It's a two-way street, and so I think it's all going to work out the way it's supposed to. But that's over with as far as I'm concerned. We're going to move forward.
Oh, that's good. Dr. Merritt, let's talk about what right now are the biggest things that you're seeing out there that is preventing our society or our community from getting beyond COVID.
So, I like to break things down. I'm a simple person. There's two things. There's behavior of the virus. There's behavior of humans. And it's how those two intermix is what's causing us to have good times or bad times. The virus is going to do what viruses do. It's going to try to survive. It's going to mutate to try to survive. We knew that. We knew last year that in 9 to 12 months we'd have some new strands. Some of those strands would be weaker. Some strands would be stronger. And some of us, myself included, predicted we'd be in a worse situation this time. And I prayed that I was wrong, but we were right because we know how viruses behave. We also know how humans behave. We knew we would probably let our guard down a little bit. And we knew that in Florida, where we're very dependent on tourism, and we have to be for our economy, that this would be where everybody comes, and it's where you mix all the petri dishes, so to speak, from a microbiology point of view. And so we got what we got. And in my term, I think this is, just to be simple, it's about 5 times worse than last year's virus that almost killed me. And so, that says a lot to me and other people. So the biggest barriers to me, we're not going to change the Delta variant, but we can change our human behavior. And there's one thing I like to say, my dad was a preacher. He always had little sayings, and I guess I'm becoming like my dad now. You always say you're not going to become like your parents, but you do if they're good parents, hopefully. He always said, be part of the solution for the problem. Don't be a problem for the solution. So Tom, Bill and I talk a lot. We don't always agree on solutions, but Bill and I are always trying to find solutions. Steve Moss calls me. He sent me something last night. We're always looking for solutions, always trying to find a solution for this problem, whether the solution is a 10% good solution or 90% good solution. Is this a solution? And then, is a solution something we can do? Maybe the federal government or the state government or local government prohibits one of our solutions. Okay. We're not going to sit here and bemoan that and criticize the officials. What we're going to do is we're going to start working on another solution. So always trying to be positive, trying to be helpful, and be part of the solution to the problem instead of a negative person. And that's something I enjoy with working with Bill, working with Steve, working with anybody. I've gone to some local businesses here to help them. It's just people want to improve this. And somebody told me, well, we're not the worst state. We're ranking 21st. And I mean, which one of us gets excited that our football team in college football is ranked 21st? You don't walk around with a with the hand symbol saying 21st. You know, you want to be number one, right? So
Yeah.
we want to be the best. And this is more important than college football. This is dealing with people's lives. It's dealing with people's health. If they don't die, they can have permanent problems. So I think the thing right now is whether we're talking about face masks work, and the more people that wear them, and the better people wear them, the better they work. That's the reason we have worn them for decades in the operating rooms, and they work. But are they perfect? No. That's the reason social distancing is a solution. That's the reason contact tracing is a solution. So there's people that will look at every solution, and we'll talk about vaccination in a minute. And obviously it is the biggest long-term solution here. You can look at each one of these solutions and be a negative person and be part of the problem for these solutions, or you can get on board and decide to be part of the solution. And whether we all agree or don't agree, it's time for me to get on board with Bill's solution. It's time for Bill to get on with Steve's solution, and all of us start working together. You know, this thing's gonna pan out to be whatever it is. Okay, will it go on 3 or 4 more years? Will we get herd immunity from this Delta variant and everybody getting vaccinated? I hope so. But how did we behave during this time? Okay, because all of us that are living are going to die at some point. But what will they say about us? We know what we can say about 1980. Yeah, what's going to be our legacy? Did we fall apart? Were we selfish? Were we bickering with each other so that more people got hurt, injured, died from this, and we fell apart as a nation? Or did this become our finest hour? You know, and I think that's, you know, we need that motto, like JFK said. Don't ask what your country can do for you. Ask what you can do for your country. Be part of the solution, and that's the reason we're here today to talk with you guys.
You know, oddly enough, we had, sadly, we've had a lot of people die because of this. But it seems like there were some more, I don't know how to exactly say this, but in the recent weeks, we've had some prominent people in this community who we believe died from COVID. And it actually spurred a lot of other people who were against vaccinations to go get vaccinated. Why is it that this particular time it's been sort of a wake-up call for some people, and a year ago it really wasn't? I mean,
well, and I'm not going to give you the medical answer, obviously, but for us, it's because it is more contagious now. The Delta variant is much more contagious now. Now, I don't have to have a medical degree to know that, because we've got more kids quarantined and we've got more kids getting it. They're not getting deathly sick, thank you, Lord. In fact, and Doc and I have talked, and we had more children die from influenza in 2020 than we've had die from COVID. Now, I don't want somebody to twist that and say, well, you don't care. That's not my point. No. My point is that, and I've talked to doctors about this. Dr. Hagehat, who you've put us together with, Dr. Merritt, I mean, he even said this is not something we're worried about, the pediatric side of it, but that's why my concern is for the adults and paying attention to it. And, you know, we've all heard the horror stories. And Tom, I think back to your question, back in the spring when this first started, and please understand, I have 2 86-year-olds that live in my house. We were concerned for the elderly because they were the ones dying and trying to protect them. But now it's not the 86 and the 70-year-olds. It's the 40s and the 20s and
35,
30s.
40-year-old people are dying.
And that's where Dr. Merritt comes in. What do we need to do to prevent that? Because before we could kind of say, well, they probably had a very poor immune system or they weren't healthy to begin with. Well, the people that are dying from it now have a lot going on in their lives. And I don't know how many times I've heard, I wish I'd have got the vaccine, or somebody said.
It's heartbreaking to see a person in a hospital bed saying, I wish I had gotten the vaccine.
There's not anybody that's watching this that hadn't had a friend or a family member get deathly sick, and they're fortunate if they hadn't had someone that they know die.
Yeah.
And I mean, this week alone, I've got someone I work with very closely, we worked with for years, lost a family member. And it's not going to stop. I mean, I think Dr. Hagehat and you know what's coming around the corner. I mean, and I'm not speaking for the hospitals, but as you said, we're going to be dealing with this for years. It is not going to go away.
Yeah, I think Bill's right. There's a very powerful, psychological term called denial. And we want to say, somebody else gets cancer, somebody else, the kid gets in a car wreck and all this stuff. And we just don't think it's going to happen to us. And and I was at a local business, and I said, because I'm me, and me is special, and me doesn't have things happen to them. And so, yeah, I think the fact is, we had the more elderly population feel that were more susceptible last time did take it seriously. So now that it's gone from affecting 60-year-olds as the mean of who's in the hospital,
You're stepping on toes now, Doc. Be careful.
Yeah.
60-year-olds, right, Tom?
Yeah. Well, hey, I was 50 when it tried to kill me, and now it's getting people early 40s. And you look at hospitalizations in some places like Alabama, it's going right below 40 at age 39. The average age of death is right around 45. These statistics, they're hitting closer to home, and now I don't have as much denial. But I do want to say one thing real quick. We talk about pediatrics. Let's talk about the data. First of all, there's three things of data. Number one, you're going to have how many people have something at a given time. That's your prevalence. It's going to take lag time. Then you're going to have step two, how many people of those went in the hospital. That takes lag time. And then the last lag is how many of those people died. So that's the reason you see these numbers. Everybody's like, these numbers don't make sense. They do make sense. It takes time for people to get sick enough to go to the hospital. It takes people in the hospital long enough to recover, hopefully, or pass away. Last week, we had over 16,000 people still in the hospital, over twice what we had last year, okay? Last night, we had over 16,000 people in the hospital in the state of Florida again. Unvaccinated people represent about 5 to 6% of this population, which really is reassuring to the vaccine trials of Pfizer and Moderna.
Unvaccinated.
Unvaccinated, yeah. I'm saying vaccinated.
Yeah.
5 to 6% of the hospitalizations are vaccinated people. And remember, the vaccines give about 95% efficacy. So that's right in line. We're seeing in real time what the trials showed us. I think that's reassuring because they're not perfect. Let me also say this, Bill, pediatric cases. Last week, we had over 16,000 people in the hospitals. 1,210 of those were kids under the age of 19. So 7.5% of all the hospitalizations in the state of Florida of COVID were people under age 19. So pediatrics are being affected with the Delta variant to a lot larger degree than last year.
Yeah, and that's what Dr. Haggie had said. He said they're getting in the hospital because they've got some kind of other thing, asthma or whatever, and it's affecting them. But he's those people on the front line, that's what gets me, is how hard they're working, and they're just trying to get us to do the right thing like you are about getting the vaccine. And so we're encouraging people. We're not requiring the vaccine. We haven't even had a discussion about requiring the vaccine. But I know so many people that wish they'd gotten the vaccine now, that can't wait until their quote unquote 90 days are up to get the vaccine. But Doc, what started this whole conversation, Doc, between us was you were telling me about what doctors individually do for individual patients in certain situations.
Right.
And I said, that's what the people need to hear. I mean, because you're hitting it on the head. And so I was hoping Tom would let you share that.
Yeah, absolutely. Because, before we went on air, we started talking about there's a lot of information about alternative medications out there floating around. I think, was it ivermectin, I think is one of them, and different things. And people are confused about whether or not this stuff works. In fact, some of the people who are watching are sending in questions. What about it? What about ivermectin? What are some of the things that people can do?
And so I want to answer that question about the other drugs, but I want to kind of go straight to the vaccination if I can, because let's start with the thing that's going to be the best thing that we can do. We've got a couple of vaccines out there that give, like I said, 95% immunity to people. And that was on the virus last year. And that seems to be holding up true because this year with the Delta variant, only about 5 or 6% of the hospitalizations are due to vaccinated people. So that 94, 95% and that 5 and 6% lineup is as good as you could. So is the vaccine perfect? Does everybody get immune to it? No, but 94, 95% of it do get an immune status from it. And even if you do get sick from it, it's showing that your sickness is going to be less severe because this is a new strain. So this vaccine's not targeted. It wasn't made from this strain. But we're seeing that it is effective against this strain, so that is good. That's the number one strategy, guys. And I'm not a person that loves vaccines. Let me just say this. I am a person, I wrote a book called 17-Hour Fast. It was built on the premise of minimum effective dose, okay? when you get a drug, you want the dose that gives you the best benefit with the least amount of risk. Okay, so like for aspirin, it's 81 milligrams. The maximum tolerated dose would be 325 milligrams of aspirin. And if you go higher than that, you're getting more toxic effects, more risk than you are benefit. So we always in medicine want to give the least amount of medicine that a person needs and not one pill more, not 1 milligram more. And that's something, the first thing we learn in medical school is first do no harm, right? So why would I prescribe more of a medicine than somebody needs? So, I'm not somebody that loves handing out medicine. I'm not somebody that goes and I revealed last time that I don't personally get the flu vaccination every year. I'll think about it this year with COVID being long, but I don't get that because I can get the Tamiflu down at the pharmacy if I get it. And so I don't want to come across as somebody that loves to push pills because all my colleagues and my patients know that I don't. I'm a minimalist, and we always like to do the minimum effective dose, MED. Well, let's think about this. When you look at the vaccines, what the FDA, what the CDC, what the drug companies, what they did is they did a trial to see how they could get almost 100% vaccination or immunization, right? So they found out they needed to give 2 doses for that, a primer dose and a secondary booster dose. The first dose got people up, somewhere above 75, 78%. People got immunity with that, okay? But they wanted to get it up to 95%, so they got a booster dose, and they got it up to 95. The interesting thing about that is when they gave that recommendation for 2 doses, and I'm talking about Pfizer and I'm talking about Moderna, they are talking about group health, population health. And that's built on bell curve and science. This is a recommendation, okay? And we need those. We have recommendations for cholesterol medicine, diabetes medicine, hypertension medicine, okay? So I'm not going against any recommendation that is built on trials and is built on group and population health. But let's talk about an individual comes to me, a doctor, or to their primary care provider. What we're talking about is individual health, not group health, not population health. We're talking about individual health. So I get somebody in there that I put them on cholesterol medicine like Zocor, and they come back and they say, my muscles are tired all the time. I don't feel good. And I think, well, this is what we're told to put everybody on, but my patient's not tolerating well. I'm going to back it down to half dose. That's the beauty. That's the whole reason you come to a doctor. That's the whole reason we went to medical school in all these years and residencies and board certified, is so that we can individualize and custom make all these recommendations, because there's no one person that just has diabetes or just has cholesterol. We have to weigh in all these different factors that people have. Some people have autoimmune disorders, et cetera. So take that thought pattern of here's the generalized thing for all groups of people, and then doctors are supposed to individualize that and custom make it. And I'll tell you about a strategy that's been put out there by others. I'm not going against the 2-shot. But for people that are saying, I've got an autoimmune, or I've got other comorbid conditions, or I'm scared of this thing, so I'm going to get no shot, no vaccination. Some people have said, why don't you just go get 1 shot? Well, let me tell you, once again, I don't want to say 1 shot instead of 2 for people that can go get 2. But 1 shot instead of 0, that may be good, because once again, the trials told us that, above 75, 78% of people can get immune from 1 shot. Well, let's be more scientific. If you got a doctor and they're individualizing, customizing your health for you, which is what we're paid to do, then they should be able to get you that 1 shot. And then a couple weeks later or 3 weeks later, after you get that shot, they can test for the M spike, M as in monkey, M spike protein. If the M spike protein is above the reference range by the lab, like we go to Quest, and the reference range is anything above 0.8 is considered immune. Okay. Well, if you get your first shot, because you weren't going to get any, and your doctor says, well, let's just take it step by step. Let's get 1 shot, see how you do. We'll test your M spike. And if your M spike is above 0.8 at Quest or whatever the lab range is, and you did well, you got immunity. You may not have to go get a second shot. Now, I will say, once again, talk to your doctor, and this is a strategy that we're talking about. And you've heard of before we talked today, we've heard of people say, maybe go around the whole country when we had a limited supply and we'll just do 1 shot. So it's not that we're coming up with some new strategy today. but we're just putting a little bit more science and a little bit more medicine specificity, so to speak, by adding the M spike protein lab to see if you're one of the 78%. If you're one of the 22% that didn't get immunized by that, then your doctor would probably recommend that you get a second shot. And you'll feel safer about it because, there's less likelihood you'll have a bad reaction from it.
I want to jump in here and say something to you, though. First, I just want you to know, if it wasn't for the bell curve, Tom and I wouldn't have graduated high school. So I just want you to
speak for yourself.
Yeah, well, I was in the class with you, remember? But no, and so when he started talking to me about all this, the M,
yeah.
I mean, when he started, I said, hold on. I said, hold on, Doc. I said, this makes too much sense. Why aren't we sharing this with people that need to know that? And that's why we're saying here today.
We're back here today. That's
good.
And
I mean, and you told me, because my next question, if you remember what my next question was, well, does the insurance pay for it? Because that's going to be the first question most people would ask. And you said insurance would pay for that blood test, is what you thought. And so, I mean, but again, these are things that I didn't know anything about until he started telling me.
Sure. Yeah.
Everybody's insurance is different. Everybody's, some people got a 90-10 policy, 80-20. I've got a high deductible. So I don't want to speak for what insurance will and will not pay, because that's as individualized as everybody's policy. But if your doctor writes it and if your insurance pays for other tests that your doctors write for, then I would assume they're going to pay for this too. It's it would be in everybody's best interest for you to get vaccinated, because, not only is it going to help you hopefully not get COVID, or if you do get COVID, have a lesser degree, that means there's less chance you go in the hospital, and guess who has to pay for that? Your insurance company. So you would think that everybody would be aligned in the right way. All these conspiracy theories that people have about all this stuff. Everybody really wants the same thing. We want people to be well. We want to keep people out of hospitals, and it makes everybody happy. So my thing is, once again, not trying to say, to the people that are going to get 2 shots, we're not trying to get them down to 1. What we're trying to do is we're trying to take people that don't want to get any, and we're adding a little bit of science to the strategy of the 1-shot dose. And and there's going to be people, and there's people that are no shot, there's people that are 2-shot. To be honest, I'll tell you my story. I don't want to tell anybody else's story because of HIPAA, but my story was I had COVID. I got really bad COVID last year, and the recommendation was to 6 months later to line up and get the shot. I got the Moderna shot, and I got really, really, really sick. And let me tell these people, I don't want to talk to them real quick. Sorry, guys.
That's okay.
And that was one of our former CEOs of a hospital here in town. I'll talk to him in a minute. But I got really, really sick from that, and I was like, wow, clinically, I got this vaccine. I got so clinically sick. And we doctors have always been able to, if your kid got the MMR shot and had a horrible reaction beyond just a little fever, chills, or whatever, you would go to them and they would have the ability to alter the vaccine schedule, or that maybe they'd go with a half dose second time. Doctors have always had the chance to alter vaccination schedules. And so everybody told me, hey, go, you gotta go put your arm up and get the second shot. Go get your second shot. Well, remember I told you it's got to be 0.8. Well, I said, man, clinically, I feel like that second dose could kill me, because my first dose was really my second exposure to COVID, because I had COVID. So I thought about it, and I said, let's go get my M spike protein. My M spike protein was greater than 2,500. I had enough immunity for over 2,500 people in my blood system. So and then later on, I found out I may have an autoimmune disorder. I fully tell you that if I would have gotten that second shot, I probably wouldn't be speaking to you guys today.
Wow.
So we doctors, that's why we went to school. That's why we are here to help people. It's why I'm on this right now talking to you guys. I'm not going to try to take your job, Tom, as an anchor. They would hate
he
me.
wants my job, though.
There are days when I would willingly give it to
job.
you. Believe me.
Yeah, I wouldn't take Bill's job for all the money in the world.
Frank, let me come back and ask you something, because this happened to a friend of mine yesterday. They almost got attacked in a retail store. I'm saying it facetiously. Tell them to get their flu shot. And so those are out there now. And I get the flu shot every year. And the reason I get it is because I'm around kids all the time, and there's so much out there. And so you mentioned the flu shot on the fly earlier, but tell us what your thoughts are on the flu shot right now.
Ooh, there's a lot of different ways to look at that. The flu shot, number one, I'm not real big into getting lots of vaccinations together. Once again, it's just, drug interaction. It's the reason that all of us doctors should always try to minimize the amount of drugs that our patients are on to a bare minimum, where we're getting the most benefit for the least amount of risk. and in medicine, we call too many drugs polypharmacy. And we really, really should have people on the minimum amount of drugs. So I feel consistently about the same thing about vaccinations. I don't want, me getting a booster COVID next week, and then the very next week I'm getting the flu, because they're, once again, drug interaction. Some people say, no, there's no problem. I just like to space those things out. I will be honest with you, this year I may get the flu vaccination just so I don't have a, COVID mimicking type of, disease. And sorry guys, getting buzzed again. And so the flu vaccine, just to let you know, around about 40,000, give or take, 40,000 Americans each year die of the flu. COVID last year, just in the state of Florida, 42,000 people died of COVID just in the state of Florida, to let you know how different this is. But does that mean flu's not serious? Flu, just like COVID, can have worse strands, can have stronger strands. And the flu vaccine is a really great way to do, to prevent that. So when I don't do the flu vaccine, the years I don't do it, I make sure that I've got a dose of Tamiflu at the Publix pharmacy with my friends.
Let's talk a little bit about some of the questions that are coming in. Some of the things I'm noticing here is people saying, well, what about people? I know people who've had the vaccine and they still got sick and died. I think it's an important point to make that the vaccine is not going to be 100% effective 100% of the time. If it was, we wouldn't even be sitting here today. We'd have all been vaccinated. This would all be over with. But as you said a minute ago, the Moderna and I think the Pfizer vaccines are about 95% effective. And if I recall, the J&J is still about 75, 78%, somewhere around there. So just because somebody gets vaccinated doesn't mean they're going to be immune completely from COVID. There's still a possibility you would get it, correct?
Correct. And so number one, the great way to test if your vaccination is good, successful, is to check an M spike protein. Whether you get one dose, like we just talked about, or you get 2 doses, you should be responsible and check the M spike. I check my M spike, and every 6 months I'm checking my M spike protein and my antibodies because I had COVID. So if you're I'm not somebody that's I don't want to go against the recommendation, because not everybody has a doctor to individualize and their medical treatment. But for those that do, I don't know that I would go get a third booster shot just without checking my M spike protein. If your M spike protein is still nice and high, then you don't necessarily need a booster at that time. And when it starts to wane down, getting close to that, whatever that threshold is, 0.8 at Quest, I don't know what that is. Is that 2? Is that 3? But when it starts to go down, that's when you need the booster. And I really don't like that. We're kind of like absolutism in this thing, very extreme. We got one side saying you need to take the 2 shots, and you need to come get the third booster. Other people saying I'm not going to get any. We have never acted like this in medicine before. We doctors we're skilled in this. We're educated in this. There's the data. Hopefully God's given us wisdom to know how to do this. And so with my clients, my patients, my friends, neighbors, people at church, my family, we are taking the best educated approach we can. Both my boys have been vaccinated, and we checked their M spike proteins, and they came back positive. So we feel, at that point, you feel both clinically and from a lab point of view, they fell within the 95% point there. So it's real easy. And let me talk about this real quick. Some people said, well, if you get COVID, you need the vaccination. This is where I want to be in the middle, okay? Because some people say, get a vaccine no matter what, okay? There's no better immunity than natural immunity. If you had COVID and you have tested antibodies and they are positive, then you have natural immunity. I'm going to be fair and balanced here. I'm going to say, I don't know that you necessarily have to go get a vaccine. If you still want to go get it, okay, be safe, okay? I wouldn't go get it too soon. I waited 6 months and it still almost killed me. But you got to remember, if you have COVID, you have a natural immunity. I would not blanket all my patients with a recommendation that you need to go get a vaccine. If you have COVID and I test that you've got antibodies, you've got natural immunization. And whether it's natural or it's artificial through that, we're just trying to get to herd immunity. And once we get to that herd immunity, hopefully this will be over.
Well, with all due respect, I had COVID. I was the first 200 people in Bay County that had it. I did not have a bad case of it. As soon as the vaccine was available, I was one of the first ones in line to get it.
What's your M spike?
I couldn't tell you.
That's my
Don't
point.
know.
That's why
Don't
I
know.
wanted him to show
Couldn't tell you.
yeah.
But I know this: I didn't get sick from either one of the vaccination shots. So I've had it. I've got the natural antibodies because I gave donated plasma after I had it, a few months after I had it, and I've got the vaccination now. Far as I can tell, I'm golden at this point. I hope.
But the key, Tom, is you said that you didn't have a bad case of it. There's been lots of studies, and this makes common sense, but we all need studies nowadays. We study everything to absolutism. But there's been studies that show what common sense tells us. The worst case you have of COVID, mine went on for a month and I almost died. The worst case you have, the more immunity you're going to have from it. Right. So it makes sense that you said you had a mild case, and I praise God for that. So you didn't have the reaction. I had a horrible case. My body's got tons of antibodies. I take the first dose of Moderna and about to croak again. So, so I think once again, if you've had a mild case and you want to check your antibodies, there's no right or wrong answer here. And once again, that's why we're talking about group medicine. We're talking about population health. We're talking about general recommendations. And Tom, you go to your doctor, you say, I had COVID. It was a light case. He checks your antibodies, which doesn't tell you a level. It just tells you if you got them or not. I wish it was a level like the M spike protein. And y'all make a very good decision to say, it's light. I've got immunity, but I probably don't have good immunity. I want to go for the vaccination. And then with you, I would go for the vaccination. How'd you feel after the first shot? Did you do okay, Tom? Yeah, I did great. Okay, we can either check your M spike protein, or if you feel good enough, we'll go ahead and do the second one. So I don't disagree with your treatment at all based on what you said. And once again, my point is, pay the $40, $60 if you got a doctor, do a telehealth, whatever. And this is the biggest health deal in the last century. And if you've got a good excuse to talk to your physician, this is it.
Mm-hmm. Let's shift gears for a second and rotate back to schools. Gulf County's superintendent made a decision a couple days ago that he wanted to close Wednesday, Thursday, and Friday because they had close to 20% of their staff and students either had COVID or had been exposed to somebody who had COVID. So they would have been quarantined.
Yeah. Yes, it was.
Almost 22% is actually what it was when we figured the numbers up. Obviously, I think in this circumstance, each school district is going to have to make decisions just like we've been talking about. Each patient has to make their own decision what's best for them. But, I mean, it's got to be a little scary to realize that it crept up that quickly on them and overtook those folks.
It's doing that everywhere because the Delta variant is just much more contagious. But Jim Norton's a great friend of mine, does a great job over there in Gulf County, but it was more of a staffing thing with them. Yeah. It was not so much
they had no lunchroom people, no bus drivers. Those were the people getting sick.
So they couldn't do what they needed to do. Yeah. Well, not getting sick, but being quarantined too.
Sure.
And so I don't know how many of them were actually sick, but I know he had a lot of them that were being quarantined. And so here's what we forgot to talk about this time that we talked about the first time. Back in the spring when we started school last year, we said we're going to take a surgical approach. Mm-hmm. So if there's a class, we're not going to close the school. We're going to shut that class down. And we've done that. We've probably had, I think it's less than 10 classes, but it could be up to 10. But we have had classes where we've shut the class down. And the rule of thumb is if there's 2 contagious students in there that test positive, most likely it's in that class.
Sure.
And so our COVID nurse does a great job, Lindsay Jackson. She is amazing. God bless her. She stays up all night long dealing with this. She then determines we need to close that class down. So we're taking a surgical approach. Mm-hmm. But we have more resources in Gulf County.
Absolutely.
So that's why it's easier for us to do that. But, no one wants anybody to get sick. And that's why I listen to Frank all the time. I mean, he's a whiz with all this stuff and understands this and has it down pat. And I know there are dozens of doctors like him around town that are doing the same thing. And I just admire the health community for the way they're guiding us right now. I really do.
Yeah. I know both you gentlemen have commitments at noon today, so we're going to wrap up in probably about 6 or 7 minutes. And I know, Dr. Merritt, you said you wanted a few minutes here towards the tail end to talk about something specific, so I'm going to turn the floor over to you.
Well, number one, thank you guys for doing this. Both TV stations have been wonderful as far as getting, as much information out as they can. Once again, Bill and I talk an awful lot. And once again, I think everybody right now just needs to figure out ways to appreciate the other person. you know, Bill is doing a lot of stuff that people don't know, whether you agree with him, whether you don't. I can tell you personally, for me, he's been very helpful with my boys. They went to school one day and then they got quarantined for 10 days. So we had to pick a different plan for this year, at least right now. So let's all figure out how we can appreciate each other and how we can help each other. Once again, let's be a solution to the problem and not a problem for the solution. We really all want the same thing. We want to get past COVID. We may have different ideas about how we do that. We may be seeking different venues of media to try to figure it out, but it's pretty simple. It's a bug. Vaccinations are great. The other things we've always done, hand washing, masks do work some degree, social distancing, all those things. But let's be careful how we manage. And if it's okay, I'd just like to lead us in a word of prayer right now for our whole nation. And dear Heavenly Father, just come before your throne right now. And I say, everybody's been affected by this, Lord. There's dinner table places that there's nobody there. There's dads, there's moms that are not there at the rec games. There's grandparents that aren't there, Lord. There's neighbors that aren't there anymore. There's also people that are dealing with new health issues they didn't have before, and they'll live with those, Lord. There's people, we don't have the liberties we enjoyed in the past. We aren't going to church and seeing everybody hugging like we used to and going to games and so forth. Lord, I ask that you just give us all a chance to look beyond ourselves, to truly be our neighbor's keeper, to love you first and to love our neighbors as ourselves. I ask that we esteem the other person more than we esteem ourselves. Let's think less of our own knowledge and wisdom and listen to other people and respect them and truly try to have some character and integrity during this time. Lord, I ask that you just bring our nation together. I pray for all of our leaders, whether I voted for them or not, whether I agree with them or not. I pray for every one of our leaders at this point, at the federal, at the state, at the local level. Lord, help each one of us to be part of the solution here. Help us to not always feel like we got to be the lead and get our way, but sometimes we need to follow and behind somebody else's solution and just help out. Lord, I just ask all these things in Jesus' name. Amen.
Amen. Thank you, brother.
Doctor, real quick, I've still got a couple people, and I asked it earlier, and we got off on a different topic, but real quickly about some of these alternative medications, the ivermectin, there was another one, I think she said hydrochlorocycline or something like that. I it's gone from in front of me. So real quickly, I think people are turning to these alternative medicines. What have you had to say about that very quickly?
Well, each of those medicines, what they tried is they tried to, what we tried to find another use. A lot of drugs can have one use, but then they find out it helps some other thing too. Like there's some drugs that help, with diabetes, and they find out it helps with something else as well. So, trying to, find a refurbished use or reuse a drug is not something new. We've done that a lot of times. So now I can't even think of it. Hydroxychloroquine is a drug that I've used and I've taken before I go to countries like Haiti for malaria prophylaxis and so forth. So it's got a lot of great uses. People were, I'm sure, well intended, and they said, "Man, let's throw a lot of these drugs and see if it helps with COVID." And I got to trust those were all done with good intentions. It looks like we've had a study here that looks good, a study there that looks bad. So once again, overall, when you look at the group of studies and what they call meta-analysis, it doesn't pan out that it's beneficial. So when I had COVID, I didn't take it. Okay, so that's all I can tell you is my take on it. You have another doctor says, "Well, I would take it." So once again, you remember, I don't take or prescribe any medicine that I don't know is going to give a great benefit with a very little risk. So the other one you talk about is ivermectin. It's a anti-parasitic drug, for hookworms, roundworms, stuff like that. And once again, those kind of drugs have been used. When I go to Haiti, every kid that comes to our clinic down there with Live Beyond, every kid, whether their belly is mushy like worms or not, we try to treat them just to deworm them. And it wasn't long ago in this country that every kid before school got deworm medicine because we walked around barefoot. And you may walk on some old cat or dog, poo or something like that. So both these drugs, it's not that these drugs are bad and evil. They're just trying to repurpose them and trying to see if they work. With ivermectin, the in vitro, the test tube studies were really, really impressive. Unfortunately, the in vivo test where you look at humans have not been as impressive. Once again, one looks good over here, the other one over here doesn't look good. so it doesn't pan out yet. But Neil Dunn and I have been talking about ivermectin for a long time, about 14, 15 months. He represents us here, and he's really, I love talking to Neil. He really cares about this community. He's always asking everybody their opinion. He even calls little old me down here to ask me why he's talking to Nobel laureates up there in Washington. So those are good. The ones that we talked about earlier, Tom, real quick, is just that we talked about dexamethasone, which, sounds really complicated. It's a steroid. It's kind of like a Pred pack or a Pred Dopa pack or whatever you want to call it, a Metrodose pack. Steroids decrease the inflammation in your body. So no big secret that this COVID causes a lot of over inflammation. So if you got something that can taper that down a little bit, put a little water on the fire, it's going to help. And I took dexamethasone when I had COVID, and it probably saved my life. I also took a Z-Pack because sometimes Z-Pack, is for bacterial pneumonia. And it's the new version of doxycycline. You asked me about doxycycline. Doxycycline's still got some great uses, but it's a little rough on the stomach, got some other side effects. So Z-Pack kind of took its place years ago. And I took a Z-Pack as well, not because Z-Pack works on the virus, but it can help prevent a superimposed bacterial pneumonia while you're kind of beat down with COVID. And of course, the zinc and the vitamin D and always just good health, And I'll tell you something that we've never understood, but there's a lot of great studies on, is chicken soups. For some reason, chicken noodle, chicken rice, there's something about the chicken. And I don't have any stock in Chick-fil-A or anything like that, but there's something about those chicken soups. And there's been lots of studies on that. So once again, you can't beat good nutrition and hydration.
All right. Bill, sit down real quick, if you would, please. I think
Bill's got an appointment.
Yeah, Bill's got an appointment. I was just going to say we're going to let both of you go. Gentlemen, I appreciate it. We could go on literally for hours. I appreciate your time again. If we need to do this again, you're more than welcome to come back anytime. I would like to say that we could find a cure for this in the next couple of weeks, and we won't have to do it again.
Never have another conversation about it.
But, gentlemen, thank you very much. We appreciate y'all being with us. Godspeed to both of you, okay? Thanks very much. And thanks for all of you for joining us here on 13 Now, our digital first platform here. And don't forget to join us tonight for News 13 at 5, 6, and 10. See you later. Thanks for tuning in.